Hi, it's Dr. Cremers, and I want to talk about a new implant that's available in 2021 for cataract surgery. Some of you have seen my other videos, so I'm just going to quickly recap what a cataract is, talk about the two key decisions you have to make if you need cataract surgery, and go through the implants. A lot of this information can be overwhelming, so I'm going to try to make it as simple as possible. My blog will have a lot more information about the head-to-head comparisons of these implants. So you've heard me talk about a cataract. It's like a pillow in a pillowcase, and this is the eyeball, for example. This is the cornea. There is a clear lens, usually, if you're young, that kind of goes here. So the cornea, the iris, and then the lens. And as we get older, the lens starts to form an opacity. Any type of slight change or protein change or color change, we call a cataract, and there's a range of 0 to 5. So 0 is kind of your natural lens, it's clear, and 5 is very, very dense. The cataract is like a pillow in a pillowcase, and the center part of the pillow is what gets kind of the opacity. Sometimes the actual pillowcase or capsule, the anterior capsule and the posterior capsule, can get opacified as well. And so we try to take care of cataracts as quickly as we can when patients are symptomatic. Usually the vision is worse than 20/40 with your best glasses or glare test. If you can't do what you need to do, we recommend doing it sooner rather than later. So we take out this pillow and take out the front part of the pillowcase, and there's two ways. So the first decision you have to make is what kind of cataract surgery you're going to choose. The old way is called manual cataract surgery with phacoemulsification ultrasound. It's the way we've done it for years. It works great. The surgeon's hand basically will make a cut in the front part of the pillowcase or capsule. The surgeon will then break open the pillow or cataract into pieces and then suck out the pieces with phacoemulsification ultrasound. The new technology is called femtosecond cataract surgery, which makes it more precise, and the amount of energy you need to remove the cataract is much less. So we recommend femtosecond laser cataract surgery in all patients, so if you can have it. The times you cannot have it is if you've had previous trauma and the cataract is unstable, or if you have very, very severe glaucoma, which means nerve damage, then femtosecond may not be an option for you depending on how severe it is, because the pressure raises a bit in the femtosecond laser cataract surgery. But sometimes the risks of not doing femtosecond is too high, and we actually recommend that even in patients that have glaucoma, because it means that your risks are less. The risks, as you've heard me say in previous videos, are pretty much always the same. The biggest risk is needing glasses, even with the best implant in the world. The second risk is needing a YAG laser procedure, which is to open up that back part of that pillowcase that could get hazy in about 30% of patients, even with the best technology, and which is done in office. It's covered by insurance. It's essentially part of the first surgery. The risks of needing another surgery, infection, losing the vision, losing the eye, the patient's death, my death, those are really, really rare, but we mention that usually to patients so they understand the risks. So sooner is better than later, because the risks can increase if you wait too long. And so that's the first decision of what kind of cataract surgery. The best cataract surgery in the world is considered now to be femtosecond laser cataract surgery, because it makes it so safe, and the risks of needing another surgery or breaking the capsule in the back is very low. So we love that safety profile of the femtosecond laser cataract surgery. The second decision you have to make is what kind of implant. And this is where it gets a little bit more tricky. Check out my blog if you have questions, but there's basically three options in 2021. The first is the old standard monofocal implant. It looks kind of like this. These tiny little haptics here, they're called these little arms, hold it in place. The real size looks kind of like that, very small, about 12 millimeters side to side there. And we fold it, we put it into the clear cornea. This is the cornea here. We make a small 2.75 millimeter incision, very small, and then just fold this. The pupil's very dilated, which it's not here. We slide it into the capsular bag. And so the first is monofocal. This is covered by insurance. It's the gold standard. We've used this for years. The downside is you're going to need glasses after the surgery, and most often you'll need glasses for distance, intermediate, and reading. Not always. The monofocal gives you one plane of vision. If you decide to try to be glasses free for distance or intermediate or reading, we kind of work with that. But the final prescription depends on your amount of astigmatism, which is the curvature of the cornea. Instead of being shaped like a basketball, it's shaped like an American football, kind of like this. Here's an example of an abnormal cornea. Its kind of shape is kind of like different. So sometimes that's the reason why you need glasses, even with the best implant in the world. So monofocal, covered by insurance, the least amount of halos and glare, after the cataract surgery, but you're probably going to need glasses. Potentially, you'll need progressives again. The second option is called multifocal. So these are new implants that were developed years ago to try to basically split the light going into the eyeball to give you distance, intermediate, and reading. The best one of those is PanOptix, and we've had a lot of experience with that. Patients are loving the PanOptix, which kind of looks like this. It has these little rings. The center ring is for distance, and it tries to help improve the vision without glasses for intermediate and also reading, but sometimes it's not 100%. So that can be a little frustrating because you pay extra, but you still need glasses, and that could be because of still a little bit of a stigmatism, but they're the best, one of the best implants we have in the world. The downside is that because it splits the light, you may have some halos and glare when you're driving or at nighttime, and that can bother some patients. So I tell patients, if you really dislike the halos and glare, or you're a big time nighttime driver or a truck driver or a pilot, you may want to not have a multifocal implant, but the downside is, you might need glasses for some distance or intermediate or reading. The third implant is the new Vivity implant, which looks like a monofocal, but it has something called X-wave technology that extends the light. So it basically allows patients to try to be glasses free for distance and intermediate, but the reading is not as good as the PanOptix, but there's less halos and glare with the Vivity. So there's these positives and negatives of each one, and it can be very frustrating because we won't know which one you are going to be the happiest with until we really put it in. So if you're somebody that really wants to be glasses free for reading, most of my patients, 90+% of patients, have been very happy with the PanOptix. But if you do not want to have halos and glare and try to be glasses free, Vivity or the monofocal would be the option. These two implants, these two categories, the multifocal and the Vivity in the category, are out-of-pocket expenses, so that can be an issue as well, because no surgeon in the world can promise to be glasses free even with the best implant and the best technology. But for me personally right now, it's a tough one. What would I choose? I think it's tricky because I would probably want to be glasses free for reading, so I like the PanOptix, but the Vivity has been having great results with distance and intermediate without glasses. So, when I need cataract surgery, there might be another implant. But for 2021, that's what we have. Please check out my blog if you have any questions. I hope this was helpful.